Once again, here are Dr. Bonati and your host, Kimberly Bermel.
Thanks for continuing to listen to American Medicine Today this Saturday, brought to you by the Bonati Spine Institute. I'm Kimberly Bermel, joined by executive producer Ethan Youker.
Good to be here, as always.
And still alongside us is world-renowned orthopedic surgeon Dr. Alfred Bonati. Now, on the phone, we have Dr. Hal Urschel, and he's joining us. He's the Chief Medical Strategist at Enter Health, one of the nation's leading drug and alcohol addiction treatment centers, and he's also an author of Healing the Addicted Brain. So thank you for being here, sir.
Thank you for having me today.
And, you know, how topical is this? Because, unfortunately, we lost one of the funniest men on earth, Robin Williams, due to depression. And I don't know about you, I'm very sad every single time I think about it, because he tried to make everybody else smile and do so much good.
He was so tortured inside, though, because if you've seen interviews with Robin, he was, when he wasn't totally manic and in character, if you occasionally you would see a glimpse of the real Robin, and you could tell there was definitely a sadness behind those eyes. Would you agree, Dr. Urschel?
Absolutely. There's obviously we know he struggles with depression and probably manic depression, although I'm not for sure on that, but recurring depression is a real problem for a large number of Americans, and we also know that he was struggling with alcohol and drug addiction, and the combination of those two brain illnesses can make a significant impact on a patient's thinking process and his mood states or her mood states, and when treated correctly, you can make a huge difference in an individual. But sometimes, if you're going out and using substances, when you have a depression or you're in a manic phase, it can really significantly unbalance the chemicals, and probably something atrocious happened in his brain to make him think that he wanted to end his life, and that's obviously a tremendous tragedy. I think one of the best things we can do as a society is learn from that, and let's try and create a legacy of helping because of his death and the sadness we all fear. Let's try and help leverage that into figuring out how other people to avoid the same situation. I can't think of a greater legacy.
Doctor, can I ask, how do you know the difference between just the blues and true full-onset depression?
Great question, Kimberly. The blues may come for a few days, maybe even a week. True clinical depression occurs over a month or 6 weeks period. The real difference is the severity of symptoms and the fact that it just won't go away. It just really hangs on. Now, you can be really depressed and you might have an hour of a day that you feel a little bit better, but most of the time you're feeling depressed, sad, blue, your energy is low, you have significant fatigue, your motivation, it's hard to get up and do anything. Many times your sleep will be very erratic, either way too much or way too little. You have significant anxiety, your self-esteem gets really low, you feel guilty about things, you feel very hopeless. And so all of these factors are being influenced by your brain changes. Your depression and manic depression is a result of certain neurotransmitter systems or your brain chemicals getting out of balance, either too high or too low. And when they're not in balance, you feel very uncomfortable. And when they're not in balance, you start not thinking clearly. And then when you're not thinking clearly, you can't shut off these thoughts, these very depressing thoughts of, I feel like I need to end my life.
You know, I have a couple other questions, because we see all the time on TV, there's so many medications prescribed for depression, and some of the side effects could be that you become suicidal. And then not only that, but then some of these medicines that people are on, they cannot just be suddenly stopped. And once that happens, normally when you take a supplement or something like that, doesn't it reduce the naturally occurring chemicals in the brain? So is there more problems once you are on medications?
No. Well, first of all, everybody's different, and we're always learning about the new insights and new. We always getting more and more additional understanding of the brain. Okay, but what happens with the neurotransmitters is when they get too low, you get depressed. You get all the symptoms we just discussed, and when you use an antidepressant, it will help within 4 to 6 weeks in many cases. But not just, and you shouldn't just use an antidepressant by itself. You need to be using therapy and exercise and wellness and stress management, the whole ball of wax like you'd use to treat any chronic illness.
Right.
But when you're using all the different tools you need to get better, and antidepressants being one, your neurochemicals go back up to the normal level. When they're at the normal level, we encourage the patient to stay on the antidepressant for about 12 to 18 months. Mm-hmm. Then after 12 to 18 months, they've been able to make other positive changes in their life, help focus on healthy coping skills, etc., good exercise. And so at that point, you can pull the antidepressant away, and in most cases, the patient does not relapse. Okay, back to depression. Now, if on top of this you're drinking alcohol, you're using cocaine, you're smoking pot, all these things are central nervous system depressants, so those are short-circuiting the effectiveness of the antidepressant. And in some cases, you don't just have depression, you have manic depression. Manic depression is a cyclical state of mood swings where your chemicals go up and they go down, and they go up and they go down. And so for those people, you need a mood stabilizer, a different type of medication, and many times you'll need to stay on that for the rest of your life. But, if you have a heart problem, if you have an orthopedic problem, sometimes those things are not going to go away, but you do have medications that can help you deal with those.
And Dr. Urschel, you were talking, we're talking off the air a little bit, and you were telling me about shots. There's shots out there now that can treat alcoholism and, I believe, opiate addiction.
Absolutely.
As well.
If we focus on an alcohol and drug addiction, the people, there's even more of a negative stigma associated with alcohol and drugs, and so people feel that society in general feels even less hopeful that you can treat alcohol and drugs effectively. That's because most of the time, most people getting treatment for addiction are getting treatment with just using the AA, the 12-step approach, which is a good approach, but it only is about 25% effective. What you need to do is you need to treat alcohol and drug addiction as a chronic brain disease, because that's what the National Institutes of Health, our main research body of knowledge here in the United States, has shown us to be. And so you need to be able to use medications in many cases, especially with alcoholism. We have a shot now. It's called Vivitrol. You get it once a month. It puts a little bit of medicine into your body every day, and it decreases your cravings for alcohol by up to 90%. It keeps you from getting drunk, not by making you sick, by just essentially turning alcohol essentially into water. You can't get high. You don't feel euphoria or any pleasant feeling from drinking alcohol, and it decreases the number of drinks that you would drink if you do pick up.
What's the name of that shot again? We're almost out of time, Dr. Urschel.
It's called Vivitrol, Vivitrol. If you want more information, you can go to our website, enterhealth.com, and we have a lot of information on there. It's also in the book, Healing the Addicted Brain. It's been approved by every major insurance company out there. It's been around since 2006.
Okay.
The medicine that's in the shot's been around since 1965, so it's nothing experimental, but it's incredibly effective. Most physicians have never heard of it. Most treatment programs won't use it, so it's really up to the American public. If you have somebody struggling with alcohol or drug addiction, contact us, and we'll be able to make sure you get access to the Vivitrol, because that can be life-changing. Think if you had a shot that would prevent you from getting drunk for a month. How huge is that?
Yeah.
Yes.
Well, it's very interesting stuff. Appreciate you joining us, Dr. Hal Urschel, again, Chief Medical Strategist at EnterHealth, enterhealth.com, also the author of Healing the Addicted Brain. We appreciate you joining us, sir.
Thank you very much.
Have a great day. All right, that's interesting stuff. Now, if people want to get in touch with Dr. Bonati, if they have back or neck pain,
sciatic pain, migraines, RSD, they can reach out to the Bonati Spine Institute. They have helped thousands. Call 855-267-0483 or visit Bonati.com. After the break, we're going to hear what's new in American medicine today. Stay tuned. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years, and it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already I feel like a new person.
I'm going home new. I can chase my grandbaby now, I can garden, I can cook, and I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.